Good evening and welcome to special coverage on Compass. I'm Amanda Anderson, Digital Media Specialist at Pioneer PBS. I'm joining you again tonight to bring some information about how our communities are responding to the novel coronavirus pandemic. This special is replacing tonight's scheduled Compass episode, but you can watch all episodes of Compass anytime online at pioneer.org/compass or on the free PBS video app. A unique collaboration is underway in Appleton. 5 hospitals want to transform the CoreCivic prison into a regional COVID-19 patient facility. Swift County Monitor News publisher and owner Reed Anfinson and West Central Tribune reporter Tom Shervany joined me on Facebook Live to talk about their reporting. Visit Compass on Facebook to listen. This is an unprecedented time, and not knowing what's going to happen next can be frightening. I know I've had to purposefully take time to reflect on my own physical, mental, and spiritual well-being. Earlier this week, I talked with Dr. Teresa Peterson and Dr. Heather Peters about their work studying the Wachosani tool, a tool rooted in Native and Indigenous philosophy to measure mental, physical, and spiritual well-being. Hello, Teresa and Heather. Thank you so much for taking time. I know schedules are so busy, so I appreciate you taking time to both join me on this virtual call. So can you start? I'm wondering if you could explain what the Wachosani instrument is.
Yeah, so first of all, just the term Wachosani is a Dakota word that means overall health and well-being. And it's really from a holistic point of view that encompasses, mental health, spiritual health, and physical health. And so oftentimes when we think of health, even Heather and I experienced this through our research, it's really often from a deficit point of view. So we focus on what's wrong with their health. And this instead focuses on building on what health practices and health, what's going well in your health. So it's very much a strength-based measure. It's grounded in Indigenous frameworks around really a relationality, as well as the interconnectedness between mental, physical, and spiritual health.
We looked at how physical health, mental health, and spiritual health, there were strong correlations between all of those. And so what that means is that as someone's physical health improves, so does their spiritual health and their mental health. And we're seeing that right now in that oftentimes individuals, we're not getting out as much, we're not doing physical activity as much. And so people's physical health could be decreasing. And then along with that, that has a negative impact on their mental health and their spiritual health. The nice thing is that if you make improvements in one area, that also then can improve the other areas. And then we also found that there was a negative correlation with suicidal ideation. And so as students' suicidal ideation increased, their reported self-Wachosani decreased. Students really know, and we're talking about 6th graders, they really know when they're not doing well.
So sometimes it's hard to put words to how you're feeling. Are there resources or ways people can learn to be self-coaching?
So I have some, and I actually developed my own mantras around mental, physical, and spiritual health. So I'm strong, flexible, and agile. I move with ease. And so that's my physical definition of health, which would probably be vastly different than something, somebody else may say. So again, it's really focused on health and not specifically illness, and that strength-based approach, and it provides motivation for change. A few weeks ago, when the pandemic hit, and I went for a walk with my son, and I was really noticing like I was out of breath, and I went for a short walk, and I was like, my heart was a little racy, and I just started, wow, what's going on here? And it kind of made me think about what was happening throughout the day. So earlier I had been watching when the president came out and talked about that this may last till July and August. And I think that ramped up my anxiety about that unknown. And so I just ramped up my mindfulness practices around yoga and walking and meditation and those kind of things.
Like Terry was saying, you just use the language that reflects where the individual's at. I've used this with my daughter who's 9. And for my daughter, I asked her, how do you know if your mind's healthy? And she said, when it's not scary. when I'm not scared. And I said, okay, what's contributing to you being scared? And so she talked about how she's overhearing when we have some news on. And so that was something that we could then control. And then I said, is there anything else? And she's like, well, she was in her 4th book of Harry Potter. And she's like, it's really scary. And so I just asked her, is now a good time for you to be watching or to be reading Harry Potter? And she said, no. So she went and got all of the books and I hid them underneath the bed. There's no right language. It's just how that person's defining what it means to have a healthy mind, a healthy body, and healthy spirit. And then having them be able to say, okay, now what can you do to help improve those areas for yourself?
Thinking about the interconnectedness of these 3 things, why is a tool like this important to use?
Well, again, I think we talked about self-agency, self-definition. If I used kind of maybe a mainstream view of health, I would probably perpetually always feel really bad about myself. So it really does help you think about what you can do and build on things that you're already doing well.
Well, it sounded like it kind of was just using testing and science to affirm what Native and Indigenous populations already knew. Like this, like you said already, this is a valid form of self-measurement.
Again, what I really appreciate is that, sometimes, while it sometimes can be frustrating, what we know to be true and then have it validated by Western science and research, to me has been kind of a lot of fun. I have a little saying that that I like to tease about, but when these kind of things happen where science validates what Indigenous knowledge are, I'm always saying like Western science is finally catching up, to Indigenous ways of thinking and being and knowing in the world. And, you see that in other things like the interrelationality, well, that is the Mitakuye Oasi, everything is related. And certainly we're not suggesting don't see the doctor, as you need to. It's just kind of recognizing that sometimes it's a very limited way of seeing things. It helps address areas where you're not just focused on symptoms.
And I think following up on that, I'm a licensed psychologist. And so I definitely know that if you are experiencing, clinical depression or anxiety or whatnot, I think one of the biggest, it's actually a form of microaggression that people say is like, oh, just think, just stop worrying or just, snap out of it or don't be depressed. This tool is not going to be the thing that helps you get out of that, but it can just be an adjunct that people can use to help, themselves and their family members.
So you talked about how the creation of this tool is rooted in Native philosophies, Native and Indigenous philosophies and practice. And so I'm wondering, knowing that not everything is intended for wider use for everybody to use always. So who is this tool for?
Originally, when we developed the tool, it was intended to support program evaluation at Dakota Wichokha. We were looking at what are, language and cultural practices and how that supports health. And so our studies affirmed that, the more you participate in language and cultural practices, the higher your Wichozani. It definitely is something that can be just practically used for individuals and families, especially during this time. We just did a recent training with Dakota Wichokha, and especially again during this time, our youth and families really need to continue to have support for integrating cultural and language practices within to support their own health. How can you integrate this tool and use it as a way to have supportive discussion and really tap, looking at for individual, but then even that collective wisdom during dialogue and how we can support each other.
So I have a quote that I've written out, so I'm going to read from your paper. It says, an intervention from Western ideology would likely focus on treating the individual who has the health problem, whereas an intervention from Native ideology would likely work with the individual along with their family, community, and environment. So just thinking about what's happening now with this current crisis and social isolation and self-quarantining and everything, how might people who are community-centric find wellness, mental, physical, spiritual wellness right now?
But for our own family, again, like I've reinstituted our We Chose Ani night. So at least once a week we gather via Zoom. We, have already assessed our health, and, we can continue to make changes to how we define and then rate our health. So we do a check-in, and then we regroup and talk about what are some goals, what are some things that we want to be mindful over the next couple of days. We do some things in our own house, smudging our house and doing that together in prayerful ways.
Can we talk about your experience working on this tool as a native, non-native team? I'm interested in learning more about that.
This started like 10 years ago, actually. And it's so funny how I never would have guessed that this is where it would have ended up. But I think that speaks to the importance as a non-native researcher of you really have to take the community's lead. You really have to listen to what they're wanting, what they're needing, and what they think is most important for their community. And also, it's all about the relationship. So with Terry and myself, and also with DW, I always have to keep the relationship as most important. But I really need to take the lead of Terry and DW. And it has to be their agenda, not my agenda. So I think just being really open to the needs of the community and just going where it takes you. I don't know, Terry, what do you want to add?
Well, we kind of are chuckling to each other because, we've certainly been on a journey, and it's been very much based on, reciprocal relationships. So I had the opportunity to really increase my scholarship and ability to do research and learn those type of skills from Heather. And she learned a lot from our community and really different ways of being. And one of the things that I noticed is, and I just continue to notice this as I work within Western groups of people, but that it's very much action oriented and like timeline, and everything's measured through time and money, and we got to hurry up and get through this agenda. And so, Heather has really learned to, I think, slow things down. And really, we always first start out and just visiting and being in relationship to each other. And I really feel like when you do that, all that other stuff gets taken care of.
Yeah, absolutely. And just one other thing, typically with the way, primarily Western people have gone about doing research, it's this top down, right? You have the university expert who then comes up with an idea, research, and then it gets implemented in the communities. And then even community-based participatory research, which is, it talks about bottom up, so that it starts with the community and then it goes up to the researcher. Terry and I even felt like that was problematic because that still maintains this hierarchy, right? Who's on top, who's on the bottom. And so we've really thought about it as more of a circle and as a reciprocal relationship, and that the talents that Terry and the DW research staff brought into it were just as important as the talents that I brought into it. And I think that that's a really important shift that I think researchers and health practitioners actually need to understand if you're going to be doing work in Native communities and actually get invited in. Because you can't just go and do work. You have to be invited in by the community. And if you're taking a top-down approach, that's not going to happen.
Cool. Thank you so much. Have a great day.
Bye.
Be well. Bye.